Sometimes I have patients come to my clinic for IVF, and then I end up doing some tests for them to check for the cause of their infertility. And then when I find the cause of this infertility, I treat it, I send them back home to try naturally, and then they get pregnant. In today's video, I'll be talking to you guys about the tests to evaluate infertility, the standard test that you should do to know where the cause of the infertility is from. And then I'll also tell you the right time to have sex, how to have sex to actually get pregnant. If you're new to this channel, I am Dr. Amarachi Ijeoma. I am a fertility physician and I talk about everything women's health and infertility. So if you want more content like this, subscribe to my channel, turn on the notification bell below, and like this video. And if you're a returning subscriber, oh, thank you for always coming to my channel. Thank you for always watching my videos. In no particular order, I'm going to be calling the tests to be done, and I'm going to start with FSH and LH. FSH simply is follicular stimulating hormone, and LH is luteinizing hormone. Now this test helps to tell you how hard your brain is working to talk to your ovaries. It's telling you the communication between your brain and your ovaries. This test is usually done on day 2, day 3, day 4, or day 5 of your cycle, preferably day 2 to day 3. The next one is AMH, anti-Mullerian hormone. Now, anti-Mullerian hormone is a test to tell you how much eggs are left in your ovaries. You know, your ovaries are the reservoir for eggs. So the AMH just tells you how much eggs are left in your ovaries. And this AMH can be done any time of your cycle. You can just wake up tomorrow morning and decide, I want to check my AMH. I want to know the amount of eggs left in my ovaries. And then you can just walk into a lab and do that. Next test you should do is called the progesterone test. The test is to show whether you have ovulated in that cycle, because it usually peaks, progesterone usually peaks 7 days after you have ovulated. Now, a lot of you know that, oh, progesterone test should be done on day 21. Well, I have a shocker for you, because it's only done on day 21 of a 28-day cycle. However, if your cycle is like maybe a 31-day cycle, all you have to do is subtract 7 from 31 days, and then that is the day you are supposed to do your progesterone test. The next test you should do is called a prolactin test. Now, prolactin, when it is high in the body, it's a hormone, prevents the release of mature eggs from your ovaries. That is, it prevents ovulation. So when the eggs are not released, the sperm has nothing to fertilize to form a baby. So prolactin test can be done at any time of your cycle. So what you should do is called thyroid function test. Now, when you have abnormalities with your thyroid gland, it can actually prevent menstruation. And when there's no menstruation, there's no ovulation. And when there's no ovulation, there's no pregnancy. Another one you should do is the ultrasound scan of your womb, of your uterus. And this is so that we can check for abnormalities of the uterus, like fibroids, like scarring, like polyp, like PCOS, and so on. The next one I'm going to talk about is called HSG. HSG is called hysterosalpingogram, and this is the x-ray of the womb. A lot of women don't like this one because it is painful, but it helps to outline the fallopian tubes. It helps to let us know if the fallopian tubes are open, if they are patent, if sperm can actually go through it to get to the egg. So as much as it is painful, it is one test that is actually important, because then you need to know, it also shows you whether there's like fluid in the tubes or there are adhesions in the womb as well. Another one is SFA. Now this is seminal fluid analysis. This is just to know how healthy the sperm is, and we want to know how many sperm cells are present, how fast are they, what is the shape, is it a normal shape? So in addition to all of this tests, I'm going to talk about something I do when my patients come to the clinic. It's called sounding the uterus. So you sound the uterus with something we call a uterine sound. So I'm going to put a picture of it right here. Uterine sound can be plastic or metal. We use it to ensure that the passage into the womb, that hole in the cervix, is open, because sometimes it can be closed, maybe due to an untreated infection for a long time, or due to a surgery done on the womb, or due to herbs. Some women use these herbs to wash inside of their vagina, and it usually causes the cervix to close up. There are several other causes of cervical stenosis, by the way. If this cervical opening is closed, then sperm will not be able to find its way into the womb and into the fallopian tubes. Sometimes this might even just be the only reason that you're not getting pregnant, and then what you would just need is for us to do a simple procedure called cervical dilatation. That means opening of that cervix, of that hole, and by the time you go back home and have sex, if other parameters are normal, you get pregnant. These are some of the tests that I'll be talking about in today's video. Well, for some of you, you might need to do some additional tests. It depends on your history, the results of some of these tests. Or for this video, these are the tests that are important. Now, when you've done all these tests, by the time we find out the cause of the infertility, then we treat appropriately. Most times, send you back home to try again for a few months. If you don't get pregnant, then you can come back. But there are a group of people that even after all of these tests, everything is normal. There is no cause for the infertility. In cases like that, we call them unexplained infertility, meaning that you have done all the standard infertility tests and nothing has been found. In a case like that, we usually now advise you to go for fertility treatments with some oral fertility medication. Sometimes when you do this test, you find out that, oh, maybe you have a high prolactin, you treat the high prolactin. Find out that you have an abnormality with your thyroid gland, you treat it. You find out that you have PCOS, polycystic ovarian syndrome, you treat it. By the time you treat these things and then you go back and try naturally and try properly, which is what I'm going to be talking about now, you stand a high chance of actually getting pregnant. Now, how do you actually get pregnant? This is by knowing your fertile window. We have about 6 days in our menstrual cycle that is actually our most fertile period, and we call it our fertile window. Now, these days are 5 days to your ovulation and 1 day after your ovulation. This is because sperm can actually live in the female body for about 5 days, and ovulation, which is the release of mature egg from the ovary, actually occurs for about 12 to 24 hours. This 6 days is the best time you can try to get pregnant. Now, because you know that this 6 days is your fertile window, it does not mean that you should have sex every day of the 6 days. No. Studies have shown that sperm is of optimal quality 2 to 3 days after the initial ejaculation. So if you want the best sperm cells to go and fight for that egg and fertilize that egg, then you have to give it space with at least 1 or 2 days interval. Now, I'm not telling you to time your sexual intercourse, no, because then it becomes uninteresting. I mean, this is supposed to be a process that is not supposed to give you anxiety. But what you should know is that within those 6 days, you should have sex about 2 to 3 times. If you want to know how to calculate your ovulation day, then you must know your cycle length. Your cycle length is the period between the first day you saw your period and the first day you see the next period. That is your cycle length. And the normal cycle length is between 21 to 35 days. So anything below 21 days and above 35 days is an abnormal cycle length. So if you want to know your ovulation day, if you have a 28-day cycle, subtract 14 days from it, and then it will remain 14 days, meaning that your ovulation is on day 14. Now, that day 14 does not mean that every month you'll be ovulating on day 14. No, it's actually an average. So you just tell yourself plus or minus 2, meaning that the fact that I saw my ovulation on the 14th today, I might see it on the 13th or on the 12th another month, or on the 15th or on the 16th another month, plus or minus 2. And then if you have like a 30-day cycle, if you minus 14 days from it, it means that your ovulation is on day 16. Don't forget also plus or minus 2. So whatever cycle length you have, even if it's 35 days, just minus 14 from it, subtract 14 from it, and then you get your ovulation day. Also, when you're trying to get pregnant, you should consider buying prenatal vitamins. When you're shopping for prenatal vitamins, make sure to check for folic acid on the container. So sometimes you might not see it written as folic acid, but make sure you look for 400 micrograms of L-methylfolate. This is so that we can prevent a condition called neural tube defect, or just stick to the good old folic acid. If you've enjoyed this video and you found it informative, don't forget to click the subscribe button, like this video, and leave a comment below.